I wrote my presentation on assessment of students for academic performance in colleges of nursing and midwifery, Yola and Jalingo, Nigeria. In summary, this study was carried out in order to assess students for academic performance in colleges of nursing and midwifery, Yola and Jalingo, Nigeria, to determine the causes of students for academic performance. Just as we can see from the slide, we can see a lot of books and the student in midst of them, indicating that students complain much over assignments that are being given to them. It looks as if it is a punishment unto them. And also, we can also look at the other slide where we have students and educators around them. That talks about coaching students on practicals and supervising them. So what? From research work and findings, a number of factors are responsible for the students' poor academic performances. These are both curricular and personal, that is, students' factors. It is expected that this study will help school administration to provide counseling services to the institutions, which will in turn lower students' tension and relieve their anxiety to enhance better performance. This study is meant to help students understand the importance of assignment in their academic pursuits. So what? It is meant to help students appreciate the importance of planning their to plan their approach to study well, and also develop effective techniques of study, which will enhance their good academic achievement. The study will enable the counselors/administrators plan and organize symposia for parents, nurse teachers, and students for each to know and define their role and effectively play it toward improving academic performance. Study background. This research work is focused on the assessment of students for academic performance in colleges of nursing and midwifery, Yola, Jalingo, Nigeria. According to Dimpa, Desi, Inobu, and Bolabore, 2013, the educational decline in the institutions of learning has much impact among the stakeholders in education, which attracts frequent attention to the way forward. A remote 2000, World Health Organization 2013, stated that achieving academic goals for student nurses is of paramount importance in the light of shortage of manpower in the industry. Canary 2005 stated, inadequate clinical training play much negative impact on training program of the student nurses, rendering them ineffective in the profession even after the achievement of long-term goal as qualified nurses. This decline in students' academic performance in contrast with the ever-growing needs of the society, which is dependent on the key players, that is nurses, in health industry. First they had 2014, and Masters at the Fine Art of Caring, according to Kathy 2007, made the researcher to embark on this project to find out possible causes of the poor academic performance of the students. Methods. A descriptive study design was used to show present situations facing the students in their academic performance and to get factual description of the existing picture which may need change, according to WACO 2006. The instrument, that is the questionnaire, was administered and collected by the researcher, colleagues, and students' representatives who assisted after obtaining student consent and explanation of the tool, which were analyzed in tables and charts. Results. From the pie chart, we can see voluminous assignments with 12%, lack of study plan and sticking to it, 12%. Students are poorly supervised, coached in clinicals, 12%. Students' inability to understand subjects and lessons being taught, 9%. We also have inadequate equipment for training, 12%. And however, so looking at what we have right now, we could also see that 10% of what we have there tells us of inadequate equipment for training as well. In conclusion, the main hindering factors to students' good academic performance in colleges of nursing and midwifery, Yola and Jalingo, are personal and curricular. This includes poor approach to studies and teachers' failure to execute their role effectively. But parents' inability to aid students adequately contributes to their poor academic performance. In any setting, to plan means to achieve the goal. Once students fail to approach their studies with planning as to how to study, they cannot achieve their academic goals. More so, teachers' effort to aid students' understanding would not be that effective. Future steps. In this study, the students' poor academic performance are attributed to good number of factors, both curricular and personal, such as poor clinical supervision and coaching, poor syllabi coverage, students' inability to understand the lessons and plan for studies, etc., etc. Based on this, counseling should be made as a component part of the School of Nursing, which will help students find their footing in the academia than wasting their time. Seminars should be held for educators, parents, and administrators as stakeholders, so as to proffer solutions to students' poor academic performance. Broad studies should be conducted on the prerequisite for accreditation for schools of nursing and midwifery before embarking on training of student nurses and midwives to ensure enough efficient tutors for the training. Question now is, what can be done really to improve students' academic performance? Can improve logistics, motivation of clinical staff positively affect the performance of students academically? So that should be looked into in future studies. Thank you for listening.